The Shift is brought to you by Joy Metrics. Welcome to The Shift. I'm Dr. Andrea Coyle. Shifties, welcome back to the next episode of the Shift podcast. Just so you know, we have a repeat offender. KV's back. For you Shifties that remember, KV was probably the 14th or 15th person that was on the podcast. She's back. She's here to share a huge shift in her career. And KV, welcome back.
Thank you so much for having me. I'm so happy to be back. It's always a fun time with you.
Oh my gosh, I'm so excited to have you back, especially because, as I just mentioned, you have made a tremendous shift. We want to hear all about it. What's going on?
Yeah, so a shift that I made in the last few months is I accepted a new role with a company called Oula. So I've made this kind of shift from Get Well when you last interviewed me to Oula. And it's been an interesting path. I think we were doing really important work at Get Well. We were digitizing engagement inside the hospital. And across care journeys is I think we were doing really good work. We were working with an AI, kind of a new AI leader and building a lot of new AI functionality. So a lot of fun. But it's interesting because I've always had this personal pull to both the like kind of community, and also to maternal health. And ULA is like really this structural redesign of maternal and gynecology care. And I felt like that was a shift that I wanted to be part of.
Well, we want to hear the shift, but I have to just ask the question, and we talked about this. Oula is actually a play on words.
Yeah.
So will you tell the shifties exactly how Oula came to be?
Yeah, it comes from the word doula. So it's a play on the word doula. And for those who don't know what a doula is, it's someone who is trained to support, and complement a birth, but really to support the birthing person. And so Oula, like at its core, is a maternal and reproductive healthcare organization. But like, here's what's different, or to use your words, like here's the shift. The core shift for Oula is it's a collaborative, midwife-led, OB-backed model of care. So what does that mean? How does it work? Midwives manage appropriate pregnancies, so low to moderate risk. Then the OBGYNs are embedded and then they're engaged sort of with clear clinical triggers. And the care is relationship based. It's personalized with like real community components, so group, community connection, education, that type of thing. The care is really relationship based and personalized. And then there are mental health components. There are, kind of wellness, gynecology, integrated throughout. And then, of course, we use digital tools as well. So digital tools to kind of help reinforce the connection between visits. Another like really important kind of difference in this model is that all of the like any need for escalation is both structured and it's practiced. So anytime it's happened, it's it's kind of well orchestrated. In other words, it's not reactive, it's pretty proactive. So it all kind of fits seamlessly together.
Maybe can I want to help unpack a few things that I think the shifties might be curious about. Number one, why did you shift to maternal health? Get well, maternal health, like that's a huge shift.
Yeah. Um, so when we look at the outcomes, or if we take a look at the state of maternal health today, 1 in 3 births in the US is now a C-section. Black,
Why, KV, why is that? Because
well,
I've never been a maternal. I mean, I have two children. I've
yeah,
birthed two children, but that is really a space that I've never been in. So why is that?
it's a number of, factors. Sometimes today you have scheduled C-sections out of convenience. Sometimes that has to do with our own structure and when we have OR blocks available, and sometimes it's preference. Um, the more you intervene, the the earlier you intervene, the more risk you have toward having a C-section. So naturally, as our because of as our medical system has advanced, we have advancements, we intervene more, and that leads to this higher rate of C-sections. So this is an intentional focus on physiological birth, and that's what midwives are really good at. Does that answer your question?
It does. It really does. Thank you.
Yeah.
I have a probably naive question. Is some of it because women are having babies older, or does that has nothing to do with it? I'm just curious.
I think it can.
Okay.
Absolutely. Yeah.
Okay.
Yeah. So it's many factors, and I don't want to speak to kind of all the reasons why. Suffice it to say, it's happening that
Right.
this is just a trend that we've seen, and a real opportunity for us because every time you introduce, kind of an avoidable surgery, you are also introducing the possibility of infection. You're introducing challenges with hemorrhaging, all these things that can introduce further risk. So, I think just from the standpoint of a potentially avoidable surgery, I think, an important thing to look at.
Yeah, it's a win.
Right.
So here's a couple other things I want to unpack. In the maternal space, and it sounds like you haven't been in the space for too long, but what are people looking for? When we think about the whole process, what are people looking for?
Yeah. I think people they want less automatic intervention, and they want more thoughtful use of it, right? We're happy that it's there, but we want to use it more thoughtfully. I think they want to be involved in decisions and not managed through them. I think they respond to environments that feel more welcoming rather than institutional. I often don't like to call pregnant people patients because they're not sick. And sometimes we call them birthing people or they're pregnant people, but they're not really sick. And so the environment is actually really important. And I want to take a few minutes when you at some point to talk a little bit about because your shifties will just be listening and they can't see what the Oula clinics look like, but I'd love to take a little bit of time to share kind of what that's all about. Um, I think they value digital access, but they also want that true human connection, and they want consistency with that connection across space and time, continuity. And then I think they want their emotional and social needs to be acknowledged along with their physical needs, whether that be, connecting with a community or someone else who's experiencing a pregnancy or a mental health challenge or, something else outside of the pregnancy and the birth.
So I just want to make sure I have this all right, KV. So Ula, what they're doing is they're shifting from the four walls of healthcare organization where women have their babies, not patients, but where women have their babies, and they're shifting it out into the community, into a whole different environment. Can you can you describe that all for the shifties and what's that look like? What's just go
Yeah.
through it. What's it look like?
Yeah, because what you're hitting on such an important point because I've been in healthcare for more than 25 years, and like we've built entire systems around inpatient capacity, around OR block time, around bed days. Um, so we've designed healthcare around like the building, but where does like health happens in the community, right?
Right.
Health happens in the community. So that's where I feel Ula is really aligned with, the community and is actually providing care in the community. So we have clinics where all the prenatal visits happen and postpartum visits can happen there as well. All the births happen in the hospital though. Okay, so I just want to make that distinction. All the deliveries happen in the hospital partner. So we partner with health systems entirely. And but the clinics are not part of the health system. They do not look or feel like medical environments. Um, I wish your folks could see they are they are just really beautiful and kind of a mix of like terracotta and cream and light and like fabrics and light, beautiful lighting. It really feels like you're in someone's home. And what we find is like when you know when you like research tells us that welcoming environments can help reduce anxiety. They can support the physiologic birth. They can encourage engagement, foster stronger relationships. Whereas when you're kind of in that institutional setting, there's even a term for it. We call it white coat syndrome. People get
Right.
anxious, people get nervous. It unintentionally kind of heightens that stress and limits like that ability to have human connection and potentially even reinforces that sense of losing control. So there's something about, kind of being in the community, not only in this like thoughtful clinic design, but also by connecting people to others. And Ula does a lot of events, for its, the community and bringing people together, like sort of book club style education and connection. Sometimes we'll come together for tea, and it really is like meeting people where they are.
And I think that's so important when someone's having a baby. It's meeting people where they are. And I'm actually, as I'm listening to you, I'm thinking about my experience when I had my two children, and it's very as it should be sterile, KV. It should be sterile, but it doesn't feel warm and welcoming, and you're welcoming someone into the world.
Yeah,
So if you
that's
think
right.
about that design that Oula has, I totally understand how that welcoming feeling makes the whole experience better.
Yeah, that's right. And another part of the community is access,
Yeah.
so it's providing better access to care. And as when you were asking me about why maternal health, and I said, hey, 1 in 3 births are cesarean. What I didn't get to is like the Black maternal mortality rate is 2.5 to 3 times higher than white women. We have real racial disparities when it comes to maternal health outcomes, and that is our system. So we have this opportunity to fix that system
You're right.
and reduce those disparities, and we're doing that. Ula. It's really the outcomes. So one of the things I did, Andrea, when I sat down, when I got to Ula, is I sat down and looked at, hey, what are the Ula outcomes of all time? So we've been around for about 3 years. We partner with Mount Sinai in New York and with Stanford in Connecticut. We have 4 different clinics. We're growing quickly. We have a number of other health systems that are in the process of kind of getting ready to launch partnerships and clinics with us. But I looked at what are the kind of ULA metrics of all time and how do they compare with the national benchmark? And like, can I share some of these with you?
I want you to. I was getting ready to say, I want you to share these. Absolutely.
So it's going to be a little bit, I'm just going to be kind of sharing a long list here, but I just, as I was building them, I just couldn't believe as we kept going how strong they were and what a difference it's making. So we talked about C-section rates. So the ULA overall C-section rate is 31% lower than the national average. Among Black patients is 24% lower than the national average. Complications. So pregnancy complications among largely uncomplicated pregnancies or low risk pregnancies, 12% better than national average. There's a metric called VBAC. Have you ever heard of it?
VBAC. Uh,
It stands for
yeah, tell
val
me.
It stands for vaginal birth after cesarean. So if you've had a
Oh,
previous pregnancy that was a cesarean birth, but now you'd really like to have a vaginal birth. So Oula's rate on VBAC is 132% higher than the national average. It's a
wow.
positive thing, right? We're delivering more vaginal babies following a cesarean. Maternal length of stay is 22% lower. Preterm birth rate is 66% lower. Low birth weight, 50% lower. Newborn complications, 68% lower than the national average. So like, across the board, we're just able to, through this kind of lower intervention model, able to see some really meaningful clinical outcomes as well as operation reaching operational efficiencies.
So my head goes in this direction a little bit, KV. All those amazing statistics that you just shared, and the data doesn't lie. Talk to me about a cost perspective
Yeah.
and and the cost perspective, the growth in revenue, and the role that nurses play.
Yeah. Yeah, I mean, because nurses like forever have been like a cost center and always trying to prove value. And nurses provide so much tremendous value, and it becomes hard to it becomes hard to like kind of narrow that down into a set of black and white dollars because it's a team sport. Healthcare is a team sport, and so but I can say that there's just massive financial impact here. One avoided C-section, you're talking about, 3 to 5,000 in lowered episode cost. And part of that is actually just shorter length of stay. So a C-section is typically a 3 to 4 day length of stay. And a vaginal birth is at least 1 day shorter. So you're talking about at least, 1,000 to 2,500 per birth, just in savings just from length of stay. Um, and then, what's so interesting too is that people will sometimes run to, well, don't C-sections doesn't aren't that isn't that revenue and isn't that bread and butter for the health system? And
Mm.
I immediately went to like, well, that can't be right. That's certainly, um, it is a piece of the puzzle, but when I really dug in, it's really not true because it's a really like sort of short-sighted part of the picture because when you look at contribution margin, yes, C-sections have a higher margin than a vaginal birth. Um, but when you add in the scarce resource, which is time and bed days, so cesarean C-sections have typically a 3 to 4 day length of stay, which is a higher length of stay than many other kind of OBGYN type surgeries. And so when you build in bed days, C-sections actually fall to the bottom of the list when you think about margin per bed day. So the idea would be that like the real opportunity is capacity redeployment. And what you would do is shift your
That's right.
avoidable C-sections to vaginal births, and that creates available OR time for higher margin per bed day surgeries.
I mean, it really, if you think about the whole model of care, this model of care contributes not just in the maternal space, but it also frees up OR.
Yep.
So that generates more revenue. And the other thing that my head's going in this direction, which it has to, because SE Healthcare is a software company, we're focused on burnout. I'm sitting there thinking, if I am the care provider at Oula, and all those great statistics that you shared, that validates my self-worth. That validates that what I'm doing matters and I'm making the difference. And I'm just curious, like burnout and turnover, I'm getting the goosebumps because burnout and turnover in these care settings probably is also below the national average. And I don't know if you've looked at that yet, KV, but we look at it and tell me at some point, like shoot me a text, because that's what I'm thinking. I'm thinking that has to be true.
Yeah, and so there's a couple things there to unpack. One is using every member of the care team at top of license is an important component of that. People want to practice at their top of their license. And what we're doing here is we're providing like kind of the appropriate care for midwives to deliver. We're providing the appropriate care for OBGYNs and then maternal fetal medicine experts, as well. And we're all working in concert. So it's not oh, there's an emergency escalation. Now what do we do? It's all built into the plan. So it all happens in lockstep. And now you have this care team that's truly working together in a collaborative, kind of co-managed way. Back to the financial impact though, because I think the economics, there's another piece of the economics that I, to be honest, didn't fully appreciate until I spent a little more time here at Oula, and that is the real growth opportunity for the health system. And I think I just hadn't quite appreciated how big that is. And let me tell you what I mean by that. So at Mount Sinai, 91% of the patients who, I shouldn't even use the word patient, right? But the deliveries that occurred
Right.
at Mount Sinai, those were people who were not considering Mount Sinai before Ula. So these are all like kind of net new, kind of healthcare consumers that are entering the system. And then there's this other really interesting data point, which is that 80% of healthcare decisions are made by the maternal like figure in the household. 80% of healthcare decisions. So meaning if I have a really positive birth, and then not only am I going to go back maybe for my next birth, but also I might be looking for a pediatrician now within that health system. I might then, maybe my husband needs an orthopedic procedure, maybe my uncle needs a colonoscopy. I guess send all these people to this health system now because I've had such a great experience. So it has this ripple effect. What we found with Mount Sinai is people are driving over bridges and through tunnels, and they're passing about 9 other health systems to get to Mount Sinai because of their relationship and their kind of their front door through Ula.
That is amazing. So this is another random question. How, and if you know the answer, that's completely fine. How are patient experience, how's that factor in when you think about HCAHPS? Is that
It's
captured?
massive. It's
Okay.
massive. So the Mount Sinai's NPS, I can actually tell you their NPS is 94. 94 for a net promoter score, which is just as almost as high as it gets. And
Right.
I think in the typical like this kind of more general OB and like birth NPS is hovers around the 40s. It's just a very different experience. And so what you're doing is it's a just a differentiated model altogether. And what we're finding is consumers are seeking it out.
Wow. This is really innovative. It's really, and I again have to say this, it is such a shift. There's a lot of shifts here. And the shift from the hospital to the community is one thing, the shift in the care model, and the shift in the role of nurses, which obviously is what is really sparks my interest, and I want to celebrate. Anecdotally, what do you hear the nurses, the care delivery nurses in the environment, what do they say about it? Do they love it? Are they, I mean, just tell us what they say.
It's been amazing. I mean, spending time, I just spent time in Brooklyn last week in one of our clinics, and I had a chance to speak with the clinic leader who's just kind of managing, the day-to-day operations of the clinic. And she inspired me. I left feeling, excited. I left feeling like, oh, we need to, figure out a way to increase our footprint because they're kind of bursting at the seams and also trying to troubleshoot with her around things, trying to troubleshoot around, how do we manage against no-shows and that kind of thing? Because moms are, have busy lives and kids get sick and all that stuff. And is there a virtual component? But no, I would say it's just been incredibly well received. And, it's the proof is in the pudding is,
Yeah.
kind of when clinics are more, there's a demand for more clinics, there's a demand for this model of care.
So, KV, you're a two-timer now on the shift. And at the end, I always ask the question, what's one of the biggest takeaways that you've learned on this new journey? And what's next? What's next for Oula?
Yeah, I think it is, uh, it's we've been talking for years about like from volume to value,
That's right.
and and volume is important too. So I don't want to discount that, but this is about like really making a difference in, the safety and quality of the care we're delivering. And then part of that is this shift from like reactive rescue care to this proactive relationship-based care that is longitudinal, that becomes kind of lifelong. And how do we create like better health in our communities? I mean, I think that's a big one. On the what's next, I would don't want to speak out of turn, but I think there is an opportunity to expand gynecology services and well women services. We don't today operate in the space of, kind of perimenopause care. I think there are opportunities to do so down the road. And I think there are ways to make shifts there as well in terms
Right.
of sort of a holistic look and more personalized and customized and tailored way. So I think those are things that we might think about down the road. Um, I think the digital component is important, and I think we'll continue to see more shifts there as technology gets better, gets smarter, AI, all of those things. But we will never, I think Oula is a company that will always stay tethered to the personal connection. And it's that kind of hybrid world that gives us, I think in healthcare, in general, it's that hybrid world of, yes, we're always going to be relying on technology, but there is the human component that really makes it special.
And you and I always talk about the human experience and how important it is. And I have to tell you, learning about Oula through our conversation today and then offline conversations, it's incredible work. And I'd love for you to come back probably in about 6 more months and give us more data, and we could talk more about Oula. And if there's anything else that I didn't ask that you think people have to know, you can share right now.
I will. I will let you know if anything else, kind of comes to mind.
Perfect.
Yeah.
And if anyone wants to reach out to you to learn more, or anybody at Oula, how can they do that?
They can reach out to me directly, and I will like send you my email address. I don't know if you're able to post that anywhere.
Yeah,
I won't try to spell my last name. It never goes well. But we'll share that information if we can post that with your
yeah,
podcast
would
information.
love to do that. KV, great as always to see you. You are so innovative and so amazing. And I have the goosebumps speaking with you because what you guys are doing over there is truly shifty worthy. It's all a shift. So thanks again. And remember, shifties, your shift makes the difference. Keep shifting. Enjoying the shift? Help us reach more nurse leaders by rating and reviewing us on your podcast app. It takes just a minute, but makes a big impact. Search for The Shift, tap those stars, and share what you love. Your feedback shapes our future episodes and helps others discover us. Remember, rate, review, and amplify the shift today.